Despite a drop in COVID-19 cases across the country, cases continue to rise here in North Dakota. Dr. Nick Paul joins us today. He is the infectious diseases physician and medical director for infection prevention at Sanford Health in Fargo, also a clinical associate professor at UND. So thank you so much for joining us today. I guess my first question is, why are numbers still going up here in North Dakota, in your opinion?
Yeah, hi Lisa, thank you for inviting me. So I think there are a couple of reasons for that. One is that our cold weather is setting in, so we have more people gathering indoors for social events and work, and all our classrooms are open, be it the schools or the colleges, and all our businesses and social events are open. And our vaccination rates, unfortunately, are a little lower than what we were hoping for. So all this is creating a perfect storm for the cases to rise, continue to rise up, even though cases have decreased in the southern states.
This is probably the million-dollar question, but why are people still hesitant to get the vaccine, do you think?
Yeah, so, a lot of people are still sitting on the fence. And the reason for that is they have personal health questions, which they are waiting to address with their primary care providers. And, we get affected by what we see on social media and what we hear from other people. So I understand it's a new vaccine. People are a little hesitant. That's natural human behavior. And then what has happened is we have a lot of backlog of care. So people are either not able to get in to talk to their primary care doctors or other providers, or they have just been hesitant because of what they've been seeing on social media. But I want to reassure everybody that now we have real world experience after enrolling 100,000 people in the clinical trials. Then we have been using vaccines in real world setting for the last 1 year, and we have administered vaccines to almost 200 million people nationwide. Throughout since last summer to this fall, we have been monitoring vaccine safety and efficacy very, very carefully, and it seems to be very safe and very effective. If you have had the vaccine, you have 17 times less likely the risk of getting into the hospital or dying or suffering other complications from the COVID-19 infection. So if you're still sitting on the fence, call your healthcare provider, discuss your personal health question that you may have. But if you're generally still hesitant, I just want to reassure everybody that the vaccine is absolutely safe and effective.
Can you talk just a little bit on the side effects? Because I feel like now we're talking boosters, but whether it's the first shot or the second shot or this booster shot, the side effects are maybe a little bit different.
No, the side effects are the same. What we have seen in the real world setting as well as clinical trials is that same side effects as the primary series, which means that most commonly what you'll have is pain at the injection site that lasts a day or two, and then maybe a low-grade fever overnight after you receive the vaccine, and maybe a fatigue and muscle aches the day of the vaccination and the day after. But those resolve pretty quickly, and you can always take a little bit of Tylenol or ibuprofen if the symptoms are preventing you from going to work or doing your usual activities. So, very, very mild side effects from the vaccine, nothing as compared to getting an infection and being at home for 10 days trying to recover and being at the risk of multiple other complications like heart attack, stroke, blood clots, respiratory failure, things like that.
Can you just touch briefly on our kids as well? I'm sure you're tracking that closely as more of our kids, more of the age groups are now being included. How do you think that's going?
Yeah, so, we don't want to rush anything. When it comes to the vaccine, we want to give our health authorities complete time to review the data and make sure that everything is reviewed and the vaccines are as safe and effective as we found them to be in adults. So FDA is reviewing it right now, and we expect next week to hear about it. There are a couple of steps that need to be done. The independent scientific committee has to verify that the vaccine is safe and effective. Then FDA has to listen to their recommendations and come to a decision, followed by meeting of CDC's ACIP, which is the immunization committee. So it takes a little time, but we want to make sure that everybody has had a chance to review the safety data and we expect the vaccine to become available if everything goes according to plan by the second week of November, I'm guessing, or the first week of November.
Doctor, thank you so much for your time today. I appreciate the update.
Thank you.
Let's send it back over to Ashley.